is there anyone else on the call that would like to share their own personal experiences of accessing primary care?
I haven't got personal experience, but I'm happy just to share a bit of our experience if you'd like. We did make a short film, which you've got from one of our deaf people, which I hope you'll be able to show in a little while. But as you know, we've had inherent problems for the last couple of years in accessing GP appointments. In the previous Intran contract, access was included in the contract. It was part of it. So part of that booking fee and part of the booking included enabling deaf people to make appointments. But sadly, when the contract changed, it only included the interpreter provision. It didn't include any access, which has caused a lot of the problems now. COVID obviously has impacted on that, but it's not just about COVID, because the problems are still ongoing and they were there before then. So I'm really pleased that we've now got an opportunity again to consult and you know, get people's experiences. I did put in the chat because there was some concern that deaf people weren't here today, and I think that is one of the problems, that technology isn't accessible for all deaf people. And even when it's here, I think today's highlighted how difficult it is, even when you've got access to technology, and that should be noted. So we are going to set up consultation groups. I know West Norfolk's going to do that as well, and so are we. We'll do evenings, we'll do weekends, we'll have as many as possible to make sure as many people can access that consultation as possible, and get more, even more feedback back to you, so you can clearly see what those issues are, and hopefully with some suggestions as to how, you know, you might be able to solve that. But the biggest thing is, lots of our deaf community, the deaf people that we work with who have sign language as their first language, they don't have good English skills, they can't access through the telephone, they can't access through the internet, they can't easily access reading or writing because they only use BSL. A lot don't even have a mobile phone, so their only way is face-to-face. And that has to be right at the beginning in order to make that call to the GP. They need someone to do that. They shouldn't have to rely on family and friends, like in some of those quotes from Anna that you saw. They're having to, because it could be sensitive and it could be confidential, and you don't want the rest of your family or your friends knowing what's happening to you. So there's a lot of experiences and a lot of issues out there, which, as we go through this consultation project, hopefully we'll be able to feed that back to you.
Thank you, Sue. That's really helpful. So when you say that people don't want family and friends, you know, don't necessarily want to rely on family and friends, I understand that. Are you suggesting that a better way would be to use a third party, like you mentioned Intran, to do that rather than to use digital or online methods?
Absolutely, that it worked well before, and in fact it was set up by deaf people years ago. There was a steering group and deaf people said what they wanted and what they needed, and so the Intran service was developed and formed from deaf people's views and their needs. Absolutely, they want someone independent where they can come confidentially, feel secure, that where people can communicate in a high level BSL, so that they know that they can communicate fluently with them in order to enable that access. And that's what happened before, but sadly it doesn't now.
Can I add, please, on to that, because Sue is talking about profoundly deaf people, BSL speakers. Of course, I deal with greater majority of people have a hearing loss of all sorts of degrees. And the problems, well, they're slightly different. They're not that different. So over the phone is very difficult. They can't hear. Some voices which are recorded are definitely not good voices. People think that having somebody with mild voice and friendly, not heavy, is going to do the trick. Well, it doesn't, because it may calm somebody who is irritated, but is not good for somebody who can't hear on a phone, because some frequencies are just not good. Zoom meetings, and we have the hospitals now very good at let's speak on Zoom. For lip reader, they're useless because actually the delay in the transmission and things like that is completely impossible for the lip reading. So whilst digitalization may be good for somebody who does not have any of those issues, for people who have hearing loss, they are pretty sort of, I'll not want to use useless, but they're not of not value.
Yes, I mean, so I have some experience of, so my husband's got hearing loss, probably through being in the army, maybe a bit of old age hearing loss, but he's a hearing aid user. So I think falls into the category that you're talking about. You know, he's not profoundly deaf, but so online, using the digital front door for GP practice, you know, he's happy to engage with that. Does have an iPhone and has that linked via Bluetooth to a streamer, so he can hear via his hearing aid what's been said. You know, there comes a point where I think, you know, as the theme has come out, where he does want to sit in front of a GP and talk to them. You know, that but in terms of accessing primary care and hearing when they call back, then, you know, there is some ability there. We also have tapped into some work that's going on nationally with younger deaf people and digital access methods. So, you know, what we're interested in this particular work stream is looking at any way that digital can help, and that might be that you have a better access to sign language interpreters by using a screen, because I understand that having to cancel an interpreter and things can also be a delay. So appreciating that there are obviously much wider issues. You know, it does sound like there are a lot of challenges in accessing healthcare. Is there a group of people who would engage with any digital improvements in accessing healthcare?
There will be a group of people like your husband who will manage with some of the facilities available, but many do not have mobile phones which have those applications. Many have very basic ones which don't have Bluetooth, which will then connect to their hearing aids. You know, many people are of very old generation and they can't see the buttons to start with, you know, to find on the keys. So and so on. So, you know, for some people, yes, it works. For younger generation, they're used to some of it, and of course they can manage better. But we are talking about thousands of people in Norfolk who are not in that category, and they do just decide not to go for their medication. They don't go to the doctors. They suffer at home. We pick them up many times and then encourage them to find a way of actually contacting the doctor on their behalf. But you know, you can't be doing that with everyone, and also people have the right to actually look after themselves independently.
Exactly. Yeah,
is not enabling them to do that, and this is what I'm saying. You know, I believe in digital and so on, but I am capable of using it for all sorts of reasons. But there are many people who can't because of the difficulties they're having. So it is just not excluding them, and it's far too many of them. That's the thing. So we need to find a way of making it. I'll give you personal experience from yesterday. I had to go and see my GP, and the surgery was empty. And there was a lady who was clearly very unwell. She needed to see somebody. She came to the practice. I now was not supposed to be going there, but she just came. She was begging to be let in, and she was put out. The receptionist was not prepared to do anything with her. I mean, that was pretty shocking. Go home and make the phone call was the answer. And she was just marched out. Now I can imagine, you know, our service users may just want to go to the surgery if they have no access to interpreters or anybody else, and they don't want to discuss with their family member. They may just decide to trot over to the surgery and say, please help me with whatever, writing down their message or whatever. And I can see them being put out, and that is just not acceptable in my view.
No, that's not acceptable. I agree with that. So there's a large, what you're telling me, I think, is that there's a large proportion of deaf people who don't use digital tools, either to access any sort of services or even in their personal life. So they don't have any sort of digital tools, and there are issues about access for them, and those are the group that we need a service like you used to have within Transfor, who will help them to access primary care, from making the appointment right through to having the consultation. Is that right?
That will be for a group of people which Sue described. For many of the service users we have, they will never consider going to an interpreting service because they don't need the BSL interpreter. Yeah, they
Right.
can hear, but they can hear face-to-face lip reading in close proximity. The phones for many are just not good, and many will not have that high-tech Bluetooth technology to connect the hearing aid to. So it is basically us thinking, do we have any exceptions for people who do require the face-to-face conversation to be able to go and actually speak to a human being rather than being all digital?
I think it's really important to recognise that there's lots of people that have very different needs, and so that's something that will be really at the core of this piece of work, that we are not just looking at a particular type of user, we are making sure that we're engaging with people that are profoundly deaf, but also people who have varying degrees of hearing loss. We also want to make sure that we are speaking with I suppose all age groups as well, because there will be people that are more comfortable using technology. It's also recognising that Norfolk, as a rural county, has lots of difficulties with access to the internet. It's something that I've already experienced this morning. So there's lots of factors that form part of this, and it's recognising that not everyone is going to choose to use digital or assistive technologies. But as part of this piece of work, that is one of the main aims, is to explore what those technologies could be for people that are looking to use them, and how we can make access to care, more easy, less stressful, and more independent. So I think it's important we stay on track. We've got a short video from someone that we've received. So Sue sent us a video of their deaf community worker, Julie Dwyer, who Cindy's going to share the video for us. So hopefully it'll work. Yeah. Can you maximise it? Yeah. Thank you.
Hello there, my name is Julie Dwyer. I'm profoundly deaf and I'm a sign language user. I use British Sign Language. I work here at the Deaf Community Centre, working for Deaf Connections. I'm one of the support workers based here at the Deaf Centre in Norwich. I've personally, though, got some great difficulties in contacting my GP. I can't use the telephone, and that causes me great issues. A lot of it now is online, but I find that when I'm using online services, I don't always understand where to go to find the online service, how to use it. And I do work with a lot of deaf people that come into the centre, and they are all having a tremendous amount of difficulties, similar to myself. None of them can use a phone, so if they want to make an appointment to see a doctor and have a consultation, they're finding it very, very difficult. For all of the deaf community, it's just not easy. A lot of them don't read and write particularly well, and therefore, if they went to the GP surgery and they started to ask for something and it was written down on a piece of paper, it wouldn't always be understood. A lot of them also can't access the internet. They don't know how, they don't know where, they don't have the technology to do it, they can't use a telephone. So what we're finding is that a lot of them now are having to ask family or friends and rely on them to do it. And really, they don't want to do that. They don't want to ask their family. They want to be able to have that private conversation with their doctor and not have the family or friend know what their problem is. It's private. It's confidential. People don't want to have to tell family and friends why they need a GP appointment. The other thing is relying on family. Not all family can use BSL effectively. So communication then breaks down when there's reliance on the family to pass on messages back to the deaf person. If that family member can't use BSL well and at a high enough level, then there's communication breakdown. What deaf people are telling me, what they really want is to be able to be independent, go into the doctor's surgery, use BSL, have an independent sign language interpreter, and be able to access communication in that way. That's what they're asking for. And that's the service that they want to have to be able to book an interpreter as well. For me, I'm actually quite a confident person. I'm quite assertive, I'm quite confident, but there's a lot of deaf people who perhaps aren't as confident, and they are having to then rely on family. And what they really want is just to be able to have a one-to-one booking with their GP with an independent qualified sign language interpreter. Thank you. And I'd just like to say there that I have seen the video previously, so voicing it over was not so difficult, but had I not seen the video, I would have found it very difficult to voice over, because that was very, very stilted.
It just goes to show the scale of the problem, really, doesn't it? I think what's that?
Anne had her hand up. Did you have something to say, Anne?
I mean, this is not personal experience, but as a parent of a deaf teenager, I can just really echo a lot of what has been said in terms of like accessing by phone in the first place. When COVID arrived, our GP surgery switched over. Everybody had to phone, and everybody had to have telephone triage. And I was having to, keep flagging up, actually, you need a different form of access for people who can't make phone calls. Although I've got a teenager who's very tech savvy and is quite comfortable using the mobile phone, we find digital sort of interpreting it is actually incredibly difficult in terms of like broadband and internet speeds. He's a full BSL user with no access to speech, and so if there's any lag or there's any sort of blurring or pixelating the screen, that it's not going to be translated fully. So I think while digital solutions are going to be helpful, I don't think they're the sort of be all and end all. I agree with Sue with what she was saying about the face-to-face thing is still so very important, even for the younger deaf members who can use the technology. It's just we live in rural counties, and when we've been for COVID tests, for example, tried to use like the Interpreter Now app, but we just can't get the connection. So, as usual, mum is being the interpreter. So, sorry, that's it.
No, that's really helpful. Thank you. I think it's really challenging, isn't it? Because I suppose as part of this piece of work, we will hear a lot of the local problems, and a lot of these problems will be problems that are experienced in other counties as well. So I'd like to think that the findings from this piece of work could be transferable to other places within the country. I suppose as part of this, one of our main objectives really is to trial some of these assistive technologies. And so doing it as a pilot phase, we will be able to test them. And I think we have to go into them with I suppose an open mind and see if they can work and can be helpful for some people, but also expect to collect a lot of information as to where they won't work or won't be appropriate. But it will help us map what the need is and what service users and patients want to see. So as part of the project, we're going to be distributing a survey asking for people's thoughts of their own experiences and what assistive technologies they have tried or would like to try, or what would make things better for them. We're also going to be, I think it was Sue earlier that spoke about, we're going to be working with a couple of our local organisations who have more experience of working with people who are profoundly deaf or who have experienced hearing loss, to help collect some really important information. We are hoping, with all of our fingers and toes crossed, that we'll be able to go and hold face-to-face events with service users. That's really important to us to be able to have that. So that I suppose I don't want people to think that this is the only way that we will be engaging with people. So, and then in addition to obviously speaking to both patients, carers, we'd also like to speak to some healthcare professionals to see what their perspective is. It'd also be really useful to hear from the perspective of BSL interpreters. I think that's something that would be maybe forgotten about, but would be really useful to hear your views at some point, Rosemary and Kim. The plan for the project is to complete this piece of work by the end of this year, this calendar year. And within that, we've talked about how we would pilot some technologies with local GPs. So in terms of, I suppose, we're thinking about what how people can contribute to the project. We've got on the call colleagues from Deaf Connection and West Norfolk Deaf Association. So is there anything, or Aliona as well from here for Norfolk, is there anything in terms of how we think we can work together to promote this project and speak with some of your patients and service users?
I think I've kind of covered what we've said we will do as in organised groups, because as we've said as well, that we mainly work with BSL sign language users. So we'd be looking at that group and bringing people together face to face in order to get the feedback for you. So that's definitely what we'll be doing from our organisation.
Excellent, thank you.
We'll give you access to the clinics so you can directly speak to patients when they come for their appointments. We just need to organize that.
Excellent, thank you. So our sort of main focuses for this piece of engagement will be to discover what people with hearing loss would like to enable them to attend healthcare appointments independently, what initiatives or devices are available already, whether these devices meet the needs and their people's experiences. Is there someone else that would like to come in and comment that hasn't been able to have the chance to yet?
I think I'd just like to make a general comment, and I think this has been very interesting. I think it's quite clear that technology will be useful for certain groups of deaf people and maybe not so useful for others, and we may need to think of other ways to improve our access to primary care that is not digital. Digital's a wonderful thing, wonderful tool, but may not work for everybody. I think it's been very interesting to hear the views of people today.
Okay. Anna, is there anything from your side of things, is there any of your group that wanted to come in?
Hello everybody, my name is Linda Murray. And a while ago, I'd been attending my GP surgery. I've been writing letters to them. I've written letters to the manager, and they are so stubborn and so constantly refusing to book me an interpreter. They're just saying that I need to write it on a piece of paper or just speak to them. So in the end, I just gave up and walked off. I didn't bother going in to see the GP. And the same with the opticians as well. I've been regularly going to the opticians, and I went with an interpreter, went to the opticians, and they said, oh, we're not now providing interpreters anymore. Because it's gone to another organisation, it's gone to DA Languages, the interpreter never turns up from DA Languages. Previously it had been with Deaf Connections, which was okay, but with DA Languages, it's just been awful. I've been very, very ill, my health has been suffering, and I need interpreters. And that's about it really, that's what I want to say. And I'm hoping that the interpreter got all of that for voiceover.
Thank you.
Brilliant. Thank you. One more, okay.
Oh, and one other thing, actually, one more.
Maybe.
When you went to the GP.
Yeah.
I was ready to go to the GP for one appointment, all set, ready to go, received a fax saying, oh, sorry, there's no GP appointment because there's no interpreter. I was absolutely furious because it was such an emergency appointment and DA Languages couldn't provide an interpreter. In the end, I contacted Deaf Connections because I was so desperate to go, and they managed to provide me an emergency interpreter just as a one-off for that appointment. But this is the problem that we're having. It's just awful.
Okay, so Peter is saying.
Yeah, he's saying he's had problems as well, not being able to get an interpreter. So I went to my surgery. I think he said it was Southgate surgery, and went to go to the doctors, and there was no interpreter this time. I waited for ages and ages and ages for this interpreter to come. And then in the end, we had to change an appointment. I had to have an appointment on June the 24th. Yeah. He's just having a conversation with somebody who's off screen, so I can't see what the other person
Sorry, yeah,
we're just. But he's saying half an hour. It was half an hour. Half an hour. Then we've got so we've got to go back again.
Peter was saying it takes him half an hour to walk to the surgery. Okay, right. So Anne wants to say something as well.
So I've got two issues really. One is the dentist. I'm hoping that the camera can see me okay. Yes, the camera can see me okay. So one is the dentist, and the other one is the opticians. So first of all, with the dentist, I have an appointment and have an interpreter through DA Languages. Prior to DA Languages, I never had any problems with Deaf Connections. I was always able to see my doctor, my dentist, and my opticians, and always able to get an interpreter, no problem whatsoever. So anyway, with this particular one, I went into the dentist, looked around, couldn't see an interpreter anywhere, waited and waited and waited. Went to reception to ask them. They gave me a piece of paper to sort of write on. So I wrote on the piece of paper, where's the interpreter? And the lady in reception, she didn't know what I was talking about. So she asked a couple of her colleagues, and they were talking, I don't know what they were saying. Went and picked up a book, which has got some DA Languages information in it. They said, just bear with us a moment. We're just going to go back in the waiting room. We're just going to call them. So I went back and sat in the waiting room, waited and waited. Oh, easily for 15, 20 minutes. Then they beckoned me over again and they wrote down on a piece of paper, sorry, interpreter can't make it, interpreter can't come. So it was an absolute waste of time. I went in there for nothing, absolute waste of time. So I then had to make another appointment. That got cancelled. Got home. And again, with the second appointment, the DA languages interpreter, not only did they arrive late because they'd had to drive 2 hours from somewhere up north and they'd lost their way and arrived completely late, they also couldn't understand anything I was signing because they were from the north and we sign a little bit different down here in the south. They kept saying, what are you saying? What are you saying? What are you saying? And they give me like a review paper, some review paperwork regarding my medical history and everything. And they couldn't make me understand it. They couldn't understand me. They kept asking me what was happening. And then the next situation I want to talk about is the opticians. Again, never ever had a problem with deaf connections when they've been providing the service prior to DA languages. Went to the opticians and they've now refused, just point blank refused to book an interpreter. So I should have had an eye test appointment in April. And the boss at Deaf Connections has really, really, really tried. She's worked really, really hard. She really, really has worked hard. She's been tremendously helpful at trying to support the deaf people in trying to get the opticians to book. And they just keep saying, oh, well, we now can't see you in April, then it's going to be May, then it's going to be June, then it's going to be July, and there's no interpreter. I can't go to the opticians without an interpreter. As soon as you go in that room and they then start to turn the lights off and you've got your glasses off and they're trying to talk to you, you know, I know and I expect that they're going to turn the lights off, but once you've then got the optician's glasses or goggles, whatever they're using in the opticians on, it's really, really difficult to communicate with them unless you're able to use some sign language. And I'm having to now rely on my daughter, and it's really not fair on me or my family to have to use them for health appointments. My health appointments should be confidential to me. I shouldn't have to be relying on my family and my daughter and then having access to my confidential private treatment and consultations. I should be able to have an independent interpreter. You know, what happens if something upsetting was disclosed? And I've had that before at the doctors. Something upsetting was disclosed, and she got really upset. And that's why we need to have qualified interpreters working with us. You know, and I've been with my daughter before for nearly 3 hours in the opticians trying to sort things out. And my daughter's a good signer, but was still in there for 3 hours because I was having all of these problems with my eyes. And it's just been an absolutely awful situation recently, just awful.
Okay, so this is about a cancelled appointment at South Wotton Surgery. From the South Wotton Surgery, it says, DA languages are unfortunately unable to tell us that they can't supply an interpreter. And then we have another one, and it's all very much the same, that we don't have an interpreter. And these, you want to show me these as well, okay? And then programs about the coronavirus. So doctor and help need advice. You want to see your doctor. I have a problem, my health and cancer, how to get interpreter for Deaf Connection, very important. And she's no touch with my family who live in London and Bedfordshire and Australia. And it makes me very angry at the last minute when they can't come. Yeah, I think that's really important. Yes.
Yeah, that was it.
And for a serious condition, Yeah, serious condition and no interpreter.
Yes, that's right.
Yeah.
So do you want me to carry on? I've got one more
Anne
thing
has one more.
to
Yes.
talk about.
When before?
So before I went into hospital, and I was an inpatient for 5 nights. And then something happened. And they said, you'd said something about an interpreter, and it was like, I hadn't ever said that. So they said, you don't want an interpreter, and I haven't said that at all. So they really misrepresented me there, the hospital staff. So I was furious about that. So, you know, I'm really seriously ill. I could die, you know, and if I die, my husband will sue them. In the end, he'll sue DA Languages for failing to provide.
Okay, we've got 2 more people, but we can email.
Okay.
And we've got one more person, quick one. Okay, right.
So this has happened. I had an appointment with my doctor, and I always get in touch with Deaf Connections first to make sure that there's going to be an interpreter provided. I've always done that. So, and they've always, when Deaf Connections provided, the interpreter was always there, always there. And they, anyway, Deaf Connections checked out for me, and they said that DA Languages have got someone coming. Because also Deaf Connections have always told me the name of the interpreter, so I know who I'm looking for, but DA Languages have not told me that, so it's difficult to arrive and see who might be there. So I arrived at the surgery and looked around. There didn't seem to be anybody there, and I went to reception and tried to ask them, where's the interpreter? And they said, just go and sit down, go and sit down. So I went and sat down, and then an interpreter arrived. So like, okay. And the reception said that they were there, and then we were waiting and waiting, and sort of time went on, and I was getting quite sort of frustrated about it. And then reception was sort of talking, and then they were talking about what's going on there. And then my GP actually came out themselves, came out into the waiting room and beckoned me in. So I think there's an interpreting error there, that there was not an interpreter. So the GP had beckoned me into the room without an interpreter. And it was like, you know, we couldn't have any communication. That just broke down there. There's total communication there. So then, you know, I had to sort of give up on that and then go back another time. And they promised me again that the DA language interpreter was coming. And then the second time they did not turn up either. And we sort of tried to have a bit of a conversation with reception and write notes back and forth, but that's very difficult for me with English being my second language. It was very stressful. And it's just, you know, it just does not work for me. It was really hard. And so for deaf people, you know, it's hard to understand what the doctor's writing about as well. It's impossible to do a well-informed discussion about that. So it was just impossible, really. And it was very frustrating and very annoying and upsetting about all of that. So the problems just they just do go on, and they'll say, you know, like, go across to the chemist for something and sort of try and point me across that way, but it's not clear, you know, I have not got clear information. So it's just a big problem going on. And I'm still waiting for them to sort of get back to me and carry on with things. I think there's some phone calls going on somewhere, and I'm trying to find out exactly what's happening there. And as I say, that time it was really late, and the doctor just walked into the waiting room and beckoned me in, and so I've had this awful experience more than once.
Can I jump in here, I suppose, to ask if presumably sounds like there are a lot of problems with making sure that interpreters are available or there when you need to have your appointment. But should an interpreter not be available, would some sort of digital or assistive technology have been helpful to you?
Yes, people are asking who Emily is.
So I work for Healthwatch Norfolk. I'll be helping with this project, and it's really important to ask the questions for us if digital or assistive technologies would have been helpful to you in those situations?
So I'm going to just reinterpret that question to Anne, okay?
Great.
So no, I would not like to use an iPad, would not like it, you know, if it's an interpreter on a device or a tablet device or something like that, I would much prefer face-to-face. It's not right on a piece of technology. No, I would not accept that. That wouldn't work at all. I wouldn't be comfortable with that. I don't know who's the other end. I don't know about their signing, you know, it's not smooth enough, the connection, and I want someone there face-to-face that I can easily communicate with.
I think in the interest of time, we should look to moving to the presentation from Richard Drummond. Richard, are you on the call?
Hello, yes. Hi.
Hello, excellent. Do you need us to share your presentation?
Yes, please.
Just 1 second.
Hi, Emily. When do you want to, sorry, you're on mute.
Yes, sorry, I was just helping share the screen. Please feel free to start your presentation, and thank you so much for joining us today. We really appreciate it.
Well, thank you very much for the invitation. It's good to hear the views of everyone so far. Are you happy to move the slides on, or is that something I should do?
We can do it for you. Just if you do a sort of Chris Whitty next slide, please, then we can take care of that for you.
Great, thank you. Well, next slide, please. Well, good morning, everyone. As the first slide said, I'm Richard Drummond. I'm Head of Research and Policy at the Royal National Institute for Deaf People. And once again, thanks for the invitation. What I wanted to do this morning was just to say a little bit about the toolkit that has been developed jointly between the Royal College of General Practitioners and the RNID, and just explain what it's about and how we think it's going to help with some, at least anyway, of the issues that people have raised this morning and elsewhere. So I'll say a little bit about the history of developing the toolkit, the main issues that had been developed, which prompted its development in the first place, and then go on to say a little bit about the toolkit itself, and then take any questions at the end. So the background is that we reckon there are around 12 million people with some degree of hearing loss across the UK. And the predictions and some of the work that we've done would indicate that this is likely to increase to 14.2 million people by 2035, which is a pretty large proportion of the population. There's an increasing recognition that hearing loss is not just a problem for older people. And indeed, our recommendation to general practitioners is that they should start to inquire about hearing loss with all patients over 55, even if there aren't any obvious signs at the time of the discussion that hearing loss might be present. And although it's not on the slide here, I should also mention that RNID have just launched on their website a free hearing loss check, so that people can go in, if they've got access to the internet, to be able to do their own assessment about whether or not they're suffering from any degree of hearing loss. So please do have a look at our website. Next slide, please. So a little bit about the history. We became aware as an organisation through comments that we had received that there were a lot of difficulties in patients with hearing loss being able to access in a satisfactory way and consult with their own GPs, their own doctors. And this led to there being a small project carried out on the Isle of Wight to explore that and to just look into a bit more detail about what some of these problems were. On the back of that, we then had discussions with the Royal College of General Practitioners between 2015 and 2019, which then led to the establishment of a joint project led by the RCGP with the aim of producing a toolkit which would help GPs to improve the diagnosis and management of deafness and hearing loss in primary care. It goes without saying that some general practitioners are very, very good in this particular area. Others perhaps have less experience, but they are all very busy. And so it is felt that we need to do what we can to help them recognize those areas where a change to the way that they manage diagnosis of deafness and hearing loss would be of advantage, not just to the patients, but to them themselves. Next slide, please. So in addition to all of that, the National Institute for Health and Care Excellence, or NICE as it's known, also recognised generally the importance of there being a good dialogue between the general practitioner, the doctor, and the patient. And I think from the sort of comments that have been made by many of the people taking part this morning, has emphasised and reiterated just how important that is. Where if you don't have this good dialogue, this good conversation, or if that's not possible for whatever reason, not only does it lead to huge frustration, but also it can potentially be quite dangerous if something important is overlooked and missed. So NICE recognise all of this, and they produced what is known as a clinical knowledge summary, which is basically a summary of those issues that are of most importance in the diagnosis and handling of potential hearing loss and deafness. And that's been published on their website, and that has also been publicised out for general practitioners and others to read as well. In addition to all of that, the National Health Service produced guidelines back in 2017 on the Accessibility Information Standard. And the aim of the AIS is to meet information needs, sorry, I missed a word there, to meet information needs and to support the needs of people who have a disability, impairment, or sensory loss. And that isn't, of course, just for people with deafness and hearing loss. It also affects people who, or rather, refers to and is supposed to support those who perhaps have a learning disability, those who have a visual impairment, or any other type of potential disability. Next slide, please. So we had identified before COVID came along that there were significant number of difficulties, and as I say, many of these have been expressed this morning. The first was the ability to arrange appointments by telephone. This, for many practices, has been the conventional way by which appointments have been arranged, and of course that can be extremely difficult in the way we've heard this morning. The issue of BSL interpretation, again, very well set out this morning, and we're very conscious that this is a big issue causing a huge amount of frustration. We also picked up that in many GP surgeries, there is a lack of a visual display as well. In other words, the next appointment is announced by over the tannoy or some sort of loudspeaker, or even a receptionist coming into the waiting room or waiting area. And of course, this means in a crowded and busy surgery, which was the case often before COVID came along, that people were sometimes missing their appointments because they couldn't hear that they'd been called in. There was also both an unawareness in practice staff that individual patients had deafness or hearing loss, but also that many practice staff weren't sufficiently trained or briefed in the right way in terms of how to interact effectively with those who had deafness and hearing loss. And so, again, we've heard this morning of some of the rather unfortunate way that some patients have been treated. And certainly this has added to the degree of stress and anxiety that they face over and above the normal levels they would have probably in going to the doctor in the first place. For many people with hearing loss, background noise can also be a big issue as well. And then again, in a busy waiting room, that can be very, very difficult for people to be able to distinguish sounds which they need to and be able to focus on these. None of this, of course, is helped when receptionists and the GP, the doctor themselves, often do a lot of their work on the computer screen and therefore are not facing the patient directly. And this makes lip reading, of course, extremely difficult as well. Next slide, please. So that was before COVID. So of course we had some extra issues that were layered on as a consequence of COVID coming along. More of the consultations now, more of the interactions between doctors and their patients are being carried out by telephone. For people without deafness and hearing loss, this itself has created a few problems, but I think many of them have been, people have accommodated to that. But of course, for people with deafness and hearing loss, this can be extremely difficult and can increase the sense of anxiety and isolation in not being able to access the levels of treatment in the way that they should be getting. I've mentioned already the greater difficulty in arranging BSL interpretation. Wearing of opaque face coverings and masks makes lip reading impossible. So obviously face coverings are used by the general population, including, for example, at receptionists in practices. In clinical settings themselves, of course, face masks, which meet the sort of clinical standards in terms of infection control, can be, again, very difficult. I know myself, having attended hospital recently, that I've seen situations where there's a combination of clear face visors, which are fine, but then underneath that, there's an opaque face mask. Now, I don't need to use lip reading. I'm very lucky that way. But for those who do, of course, that would defeat the object of having the clear mask, the covering in the first place. So we are trying as an organization at every opportunity to promote the use of clear face coverings for the general population, but also clear face masks used within clinical settings as well. And we're constantly in dialogue with the NHS to try and get a greater adoption of these, but we know from our experience that these are not being used as widely as we would like to see. In addition, because things aren't working in the way they were before COVID, patients are often having to undertake the appointments in new areas, so perhaps not in the conventional surgery settings that they've been used to. They've had to perhaps go to different places to be able to have their appointments. And of course, in those places where reasonable adjustments had been made previously, they have not been carried over into the new settings. And of course, this has created major as well. So patients have expected to have been able to have seen their doctor in the normal way, but instead have had to go perhaps to a different surgery to meet the doctor or the nurse. And of course, then they've not been seen in the way that they would have previously been before COVID. And the final point here, and I'm sure there are plenty of others, so time has meant I can only sort of summarize these. We've seen a decreased referral to audiology by GPs, and where people have been referred, there has been a reduction in the audiology services available as well. Now, much of that can be explained because hospitals and other settings where audiology has been delivered have sometimes had to change the way they've done it to be able to cope with the influx of people with COVID. But we are, again, lobbying and putting pressure on the NHS to return to at least the audiology services they were providing before COVID came along, and obviously to increase these as well to respond to the backlog in demand that there is for people seeking these services. Next slide, please. So the toolkit was developed, as I say, jointly between RNID and RCGP. The work was led by Dr. Davina Maru, who's the RCGP clinical champion in deafness and hearing loss, and as a clinician who has a huge amount of experience and has gained a lot of insight into the issues from people living with deafness and hearing loss. The overall aim of the toolkit itself is to increase confidence in GPs in the way that they interact with their patients with deafness and hearing loss, and that they then refer them for hearing assessments by audiology departments, or even in some cases to private audiologists if that's necessary. We wanted to ensure that the toolkit was widely available to doctors, but it's also available to those of us in the general public as well. So if you are interested, you can go into the RCGP website and the information is available there. Clearly, some of the detail about some of the different parts of the toolkit may not be available because they are available just to RCGP members, but the overall description of the toolkit and what's in it is freely available. So I would encourage everybody to have a look at that. The resources include an essential knowledge update, so bringing doctors up to date with what the current research and knowledge is about deafness and hearing loss. It provides teaching materials. There are podcasts so that busy doctors can take some time out and perhaps, if they're driving in the car, listen to some material through podcasts, and slides as well for them to be able to follow too. The toolkit also includes the hearing-friendly practice charter for practices themselves to sign up to, and essentially this is a set of steps that they can take which increase their awareness about how to interact effectively with patients with deafness and hearing loss, and to generally ensure that they recognize what the needs of the patients are and to do as much as they possibly can to respond to those needs and provide the service that people want and require. So, I mean, to summarize the toolkit, as I say, is to raise awareness about the different forms of deafness and hearing loss and to make people recognize that not everybody who has a degree of hearing loss is the same, recognizing that people have different needs and requirements. The aim of the initiative is essentially to make sure that the needs of the patient are better recognized and people and practices respond to those. It encourages the patient's record to be flagged up so there is better planning ahead of the appointment. And again, I think that reflects a lot of the comments that have been made this morning. And the overall aim is to reduce the variability in the experience that the patients with hearing loss and deafness have when they go to a GP practice, so that they're not having to jump through all the various hoops to be able to just get the basic healthcare and the basic discussion that they need to have with practitioners and with nurses as well, because of course some of the appointments are with nursing staff as opposed to just doctors. So next slide, please. So the toolkit has, as I've mentioned, communications tips. It has practical tips about, for example, how the surgery can be modified slightly to make it easier for those who come in. So that may be around about the way that receptionists do their work and then interact with other people. There's information for NHS managers and commissioning organisations who may want to have a discussion with the GP practices who provide services in a given area to make sure that they are doing as much as they possibly can to meet obligations, not just to their patients, but obviously to the rules and guidance around accessible information as well. And then there are also specific COVID-19 tips and information in there as well. Next slide, please. So, final slide, Toolkit was launched towards the end of last year on the RCGP website. And just as I said before, there is still information on there. There was a specific session at the RCGP conference in February of this year. And the RNID had a virtual stand at the conference where we were able to take questions from those who were attending the conference about the toolkit itself. And we had a number of interesting observations and questions about that. The RCGP launched a survey in March this year to try to find out from the profession themselves about their awareness of the existence of the toolkit and what impact it had had. That survey, as I say, was launched in March and it closed at the end of April. And I'm hoping to receive back fairly soon from RCGP the results of that so that we can then look at what awareness there is about the toolkit, what impact it's had, and then jointly with RCGP, we can consider what else we need to do to increase publicity about it and to see if we can get a greater uptake. And we're obviously very keen to hear from organisations represented here this morning and generally from, for example, Healthwatch organisations more widely about the sort of experiences that we have, because we want to make a difference. We want to ensure that what we're doing can at least actually make a real world difference to people when they actually go and consult their GP practices. So that's all I was going to say. I'm happy to take any questions, but that's it from me for the moment. Thank you.
Does anyone have any questions for Richard?
I do, if that's okay.
Yes, please, Rachel.
Hi, Richard.
Hi.
Hi. I just wondered, with the toolkit that's been developed, is it something like immersive training, like hearing loss awareness training, for example, delivered by Healthwatch Norfolk, or is it more of a toolkit that's available digitally and on paper, for example? And the only reason I'm asking is I come from a charity that worked with visual impairment and sight loss, and we found that when we were delivering to other companies and other health professionals, it was really, really effective when it was delivered in small groups, very accessible by people with sight loss themselves.
Yeah, I mean, the majority of the materials are available online, and I'm not sure the degree to which they can be adapted for people with sight loss. I mean, I don't need to go away and have a look at that. I should explain that I wasn't personally involved in the production of the toolkit. That was my colleague. I'm actually covering for her on maternity leave at the moment. So I've only been with RNID for a couple of months. But I would agree with you when you say that actually a lot of the materials do benefit from being delivered in groups, because I think that's when you get some sharing of insight and experience and knowledge, and best practice, because obviously if one particular GP practice has evolved a way of being able to work effectively with deafness and hearing loss patients, it's a great idea if we can share those ideas around, particularly for practices that are very busy as well. So it's a good shortcut.
Thank you. I think the toolkit will be very effective. It sounds fantastic, and as long as it can be delivered digitally, in person, and accessibly, it sounds like a really good idea. way to move forward.
Good.
Thank you, Rachel. Aliona?
Thank you. Thank you, Richard, for that. Of course, all the difficulties you highlighted is something we're living with day in, day out. So in a way, you preach to the converted here. Yeah. Glad to hear that there is a toolkit. It'll be good to see it. You haven't made reference to what the toolkit actually consists of, so it'll be nice to get our heads around. But Rachel is correct. Before COVID, I have trained many medical practices across Norfolk, and it's scary actually what one is finding and what little knowledge it exists or thinking outside the box. So yeah, people with sensory disabilities in general, generally speaking, the medical profession doesn't think how they're going to address their needs, make sure that they can partake and they can independently receive their health support. So it's all pretty worrying actually, because you'll think that as medics, they will understand a little bit more about hearing loss because they're trained on their ears, so to speak, on ENT, but actually even the basic understanding of hearing loss just doesn't exist. So I'm glad this is progressing, but it'll be good to sort of involve the organizations who actually day-to-day are in touch with healthcare providers, for us to know what RNID is doing and for us to work slightly closer together. So lots of messages in one, sorry.
No, thank you for that. And as I say, just to repeat again, you know, we are very keen to hear back from people with real world lived experience of the difficulties, because I mean, we've heard some of those this morning, but it would be good for us as a UK organization to understand, you know, just how big a problem this is. I can only imagine that some of the experiences that people have articulated this morning are probably common across the whole of the UK, but it would be good for us to understand if that genuinely is the case, because it helps us then in our campaigning and lobbying activity. If we can say, look, we've been in touch with people in Scotland and Cornwall, Northern Ireland, Wales, and they're all saying the same thing, or roughly the same thing, which is X, Y, and Z. It helps us a lot to be able to say that. So please do feed into us, you know, people's experiences on that. It's really great for us. Well, it's not great for us to hear about these things, but it's very useful for us to learn about these things.
Thank you. Can I come across to Anne?
Yeah, I'm assuming that the toolkit is something that's like optional training for GP surgery. It's not like a mandatory sort of training. I'm just wondering whether it's sort of possible for what might be really useful is actually if deaf people actually audit their own GP surgeries and to find out where they need sort of additional guidance and things, because obviously the deaf people are probably the best place to know where they're having smoother or more difficult experiences and which GPs might be recommended to undertake the training. And the other comment was whether there's any guidance in there for GPs about sort of like earwax for hearing aid users, because this is something that's being flagged up quite constantly among our local deaf community, is that the GPs are now refusing to do like earwax removal. And hearing aid users, it's having a quite significant impact on their ability to hear and get new molds and things. And they're actually now being told that they need to pay to have this done, something like £40 an ear. This is what is happening in our area. I know I see Aliona is waving her hand there, so I will let you answer.
Okay, thank you. I mean, dealing with the last point first, I mean, we are very aware of the variability in various parts of the country about whether practices are prepared to continue to do any treatment for earwax. There is guidance which has been issued via the NHS to practices, but at the end of the day, it would appear to be up to the CCGs and the way that they commission services in terms of whether or not they're prepared to pay practices to undertake the earwax removal services. So we are aware that that's a problem. I don't have any solutions to that other than, again, just a request that if people have evidence about that, to keep feeding that into us so that we can build up. We're trying to build up a picture at the moment. We know there's a huge amount of variability. We've already had people telling us, as you have just now, Anne, about, they've gone to the GP, been diagnosed that there's been an earwax problem, but they've said, well, we don't do that anymore. You have to go off to a private, and pay for it. So we already know a few of those problems are there. What we don't know is the degree and extent to which that is happening, and that would be very useful. Going back to your first point, I think that's a really good one. And I think I would certainly encourage those people who are experiencing a difficulty with deafness to actually have a look at the toolkit, and then, when they go to their practice, be able to say, look, we've looked at what's available on the RCGP website. We believe that you as a practice are perhaps not meeting those guidelines in the way that we hope you would, and this is causing big problems for us in actually getting the treatment. Put a bit of pressure on the practice to at least become more aware and actually access that training and briefing information and take some action on it.
May I reply, Emily, to Anne, because I'm so frustrated with the communications from GPs, because it's just completely untrue. And for once, I will say that the Norfolk and Waveney CCG, although it has taken quite a bit of time for us to persuade them, they did commission the service. So whilst GP practices cannot do the irrigation in Norfolk because of COVID, the microsuction, which is much safer procedure than the irrigation or syringing, the microsuction is carried out by here for Norfolk, and it has been carried out for the last 3 years under contract with the CCG. Initially for Norwich only, the contractors, Norwich CCG area, if you remember, they had 5 of them. Then they extended when COVID kicked in and the other areas practices stopped doing it. Then they extended our contract to the south and the north, and as from 8th of April, that contract has been extended to the west. So actually the GPs, and many are doing, we have thousands of patients coming to us. The GPs are just sending the referral for microsuction using the ERS, and we then contact the patient and arrange the appointment. So the only area which is not covered at the moment is in Great Yarmouth. However, we have the contract with the James Paget Hospital. So the GPs in Great Yarmouth and Waveney can still refer patients to James Paget, and then they are being passed on to us. So we provide the community clearance for non-complex patients across Norfolk. And we have been doing that for months. Throughout COVID, we never stopped. We adapted the operating model and so on. The challenge we have is going back to what I said at the start of this meeting, is when we get people who need an interpreter, is booking the interpreter to come to that procedure, to be able to interpret the consent and obviously throughout the procedure to interpret what's going on is a nightmare. And some surgeries are cooperating and some are not. But it's completely untrue that there is no provision, because there is some practices are choosing not to read the correspondence sent to them, and they still pretend that is not happening. So the £40 fee you made the reference to, we applied it in the past when we couldn't help people from other areas under the contract, but Norwich, so we had to cover our costs. But now less and less they are patients who have to pay, because we can see them under the NHS referral system. So, but there are patients who just don't want to bother with the GP because they can't get to them, because all the problems we discussed. So they're happy to pay the fee. It's only because we can't just run it with nothing. We employ highly qualified nurses. We have the microscopes and everything else we need to have to do the procedure. So it's not any different to the hospital setting. And we take it on a mobile clinic across Norfolk. So the provision is there. So please inform all the service users you have that they just need to insist on the GP making the referral, because we're there. And the waiting time is not long. So unlike the hospitals, 13 months, we have maximum 4 weeks waiting time if it's a busy period. Yeah.
Sorry, does this cover Lowestoft and Yarmouth area then? Because this is
so
where
for Lowestoft and Yarmouth area, GP needs to refer to James Paget, because then that list is sent to us. So we are treating them at James Paget Hospital, but the referral, instead of coming directly to us through electronic referral system, it goes to James Paget, and then we get the list. So it's just slightly longer-winded way, but yes, the county is covered.
Okay, thank you.
Thank you. Is there anyone else that had any comments or questions for Richard? Just need to wrap up that part of the agenda. I think we're okay. Excellent. Thank you so much, Richard. Really appreciate it. It's good to hear that there are some plans in place. I particularly like the idea of having sort of hearing-friendly GP practices. It's just, I suppose, then evaluating GPs against that standard and making sure that they're delivering what they say they will. But thank you. In terms of, I suppose, starting to think about drawing this to a close, we've heard some really interesting things today, and the problems that we've heard from all of you are, you know, they're surprising, but they're also things that we have heard before. And it seems there's still a lot of local issues with access to interpreters in terms of aligning with your appointments. COVID has obviously had an impact, but this was a problem before. I recognise that a lot of people really value that face-to-face appointment, and that's something that's really important. And so that will probably come through on this piece of work. In terms of how you can all be involved in the project going forward, we are looking at obviously holding face-to-face events with people. We will be promoting those through ourselves and through our collaborators that are on the calls. There'll be the opportunity for you to join us at one of those face-to-face events. We're also going to be promoting our survey. Our survey will be available in online, Word and easy read versions. I would also say that please feel free to contact Healthwatch Norfolk just with your views, or if you'd be happy to talk to us on a one-to-one basis, that would be really valuable also. I suppose like to pull in Anne or Viv if there is any comments from a CCG side of things.
Well, I'd just like to say thank you to everyone for joining today. It was very interesting to hear everybody's views, and going forward it would be really good if we could identify any digital tools that can help with access to primary care. I appreciate that's not going to be relevant to all of you, but if we could get something to help some people, that would be good.
Thank you. I think that's really important that you know, we recognise that technology or digital tools will not be appropriate for everyone or useful for everyone, but if there are groups of individuals that we could improve their care with by use of a digital or assistive technology, then that's something that we would really love to do and push forward on. Okay, I suppose I just wanted to again apologise for the difficulties we've had with technology today. It just really highlights to me the importance of doing this and doing it right, and it's making sure we find the best way to engage with the people that are really important to this project. I'd like to thank everyone that has taken part on the call. We also have a sort of steering group for managing the project that meet a few times a year. So we are looking for an individual with lived experience, so either someone who's deaf or is affected by hearing loss, to join us on that steering group to provide that input from someone that knows what the real problems are. So if you are interested in that, then please do get in touch. Thank you, obviously massive thank you to Rosemary and Kim for being our fabulous interpreters today. You're both amazing. Yeah, thank you to everyone on the call for your contributions. It's really been valuable, and I will follow up with all of you with some notes from this meeting so you have that, and our next steps in terms of promoting the project, and thinking about arranging dates for us to have those face-to-face meetings with you. Do you have anything else? That's all from me. thank you so much again, and I hope you enjoy the rest of your day. Thank you. Bye-bye.
Thank you.
Thanks,
Bye-bye.
everyone.
Emily,
Bye-bye.
thank you.
Bye-bye.
Bye.
Thank you.